Okay, so today we're going to dive into a really critical topic, one that's often surrounded by a lot of misunderstanding. We're not just talking about numbers here. We're talking about finding a whole new way to look at and solve a crisis. It's time to reframe Black maternal health. Now, I want you to just let that statement sink in for a second, because it's a really powerful place to start. What this is saying is that medically speaking, we have the answers. The science, the data, all the research on best practices for safe childbirths, it's all there. We know what to do. And that right there leads to the central, heartbreaking question, doesn't it? If we have the knowledge, if we know what works, then why on earth are Black women still dying at such alarmingly high rates? Why is this gap still so wide? That's what we're here to unpack. To really get to the bottom of this, we first have to clear away some of the noise, some of the most common but, totally wrong ideas about where the problem really is. For years, a lot of the conversation was just about awareness. The thinking was basically, well, if patients just knew more, if they were more aware of the dangers, or if they just spoke up for themselves differently, then things would get better. The blame, a lot of the time, was put on the individual. But here's the thing, it's not. The data and just the real lived experiences of countless women tell us that's not the root of the crisis. So, to find the real answer, we have to look deeper. And when we do look deeper, we find what's really going on. It's a concept that shifts our focus from the person to the real source of the failure, something called the impact gap. Okay, so what's so powerful about this is how clearly it lays out the two different worlds. In that first column, you've got everything the medical community knows, all the proven science, the guidelines, the life-saving information. But then you look at that second column. That's what so many Black patients actually experience, getting their concerns dismissed, being ignored, and running into all these barriers just to get basic care. And this is it. This is the core idea. The impact gap is that chasm. It's that dangerous, sometimes deadly, space between what should happen based on medical science and what actually happens in that hospital room. Exactly. That gap isn't about one person's mistake or a patient not knowing enough. It is a systemic failure. It's a breakdown in the entire structure of how care is delivered, and the consequences are just devastating. So once you see the problem as this systemic gap, the question has to become, how do we start to close it? And this brings us to a possible way forward. To fix this gap, you can't just keep saying the same old things. You have to reframe the whole conversation. And that's exactly what new things, like the Reframing Black Maternal Health podcast, are setting out to do, to face this impact gap head on and start to close it. This right here, this is the promise. This is the whole goal. It's about taking all that knowledge we already have and making sure it actually gets to the people it's supposed to help. Because when we finally bridge that divide, outcomes change. It is that simple, and it's that profound. This isn't some unsolvable puzzle. When the system delivers the care it's supposed to deliver to everybody, lives are saved. The outcomes just change. And that leaves us with one last, really crucial question to think about. Because this isn't just a problem for hospitals or for politicians, it's a question for all of us. Now that we can see the gaps so clearly, how do we start building the bridges in our own communities, in our own conversations?